The World Health Organization is reporting 4 million coronavirus cases globally in the past week, a number that seems big, but that the WHO says actually marks the first substantial decline in weekly cases in more than 2 months. Now, while the number of worldwide deaths also decreased, there was a 7% increase in deaths in Africa, where billions have been left unprotected from the pandemic.
As a continent of 1.3 billion people, we have just under 3.5% of our population, eligible population, that has been fully vaccinated.
The WHO says out of the more than 5 billion COVID-19 vaccines administered around the world, only 2% have been in Africa.
That's not because African countries don't have the capacity or experience to roll out vaccines. It's because they have been left behind by the rest of the world.
The African Union is accusing the companies that make the vaccines of denying African nations a fair chance to buy them. And there are no indications Africa will see a remarkable turnaround in its fortunes, with rich countries contemplating giving booster shots to their populations.
We want to buy from their same manufacturers. But to be fair, those manufacturers know very well that they never gave us proper access. We could have addressed this very differently.
In her State of the Union speech Wednesday, the European Union's chief executive pledged to donate 200 million extra doses to Africa and low-income nations by the middle of next year.
Our first and most urgent priority is to speed up global vaccination. The scale of injustice and the level of urgency is obvious. This is one of the great geopolitical issues in our time.
But the WHO says such pledges have so far rung hollow, noting high-income countries have promised to donate more than 1 billion doses, but less than 15% of those doses have materialized. In the U.S., the Food and Drug Administration is set to debate the topic of boosters on Friday. Earlier this week, a group of scientists, including 2 retiring FDA leaders, argued in The Lancet that the current vaccine supply could save more lives if used in the billions of people who remain unvaccinated worldwide. Caryn Ceolin, CityNews.